And now for the Jane Warren Award winners. This just is a reminder, this is an award in remembrance of Dr. Jane Warren, who served as the science director at HEI from 1999 until her retirement. It supports early career graduate students and postdocs. We pay for their registration and their travel, and they are about to do lightning talks. So our first person up is Albert Chi, who is going to talk about pollutant exposure following fires at the wildland urban interface. So Albert. Clicker's right up there.
Just the green button?
Yep,
or?
just that's it.
Okay, like the big one.
Yep.
Got it. Sorry, clickers, confusing to me. This is fancy. My name is Albert. I'm a second-year graduate student at UT Austin. I'm co-advised by Drs. David Allen and Dr. Hildebrand Rees, who you can see here. Also, Dr. Michel, hello. And I really wanted to talk to you today about some truly just devastating wildfires that occurred in LA in early January. The Palisades fire and the Eaton fires, which took place in the Pacific Palisades and Altadena, respectively, damaged or destroyed more than 16,000 homes and burned nearly 40,000 acres in an extremely fast fashion in early January in Los Angeles. And these fires are part of a growing trend of wildland urban interface fires, which have the unique kind of ability to cause negative exposures because, wildfire PM. Sorry, I got a little nervous. Because, wildfire PM is not necessarily well documented quite yet, especially at these interface fires and property. So to better understand what was caused or the health effects that can be caused by these fires, we deployed a mobile van, an electric van, 4D transit, with particular stars that show the aerosol mass spectrometer and the Focus PTR TOF-MS, which can use mass spectrometry to measure PM1 and VOCs, as well as kind of a black carbon monitor, a heavy metals monitor, and a QuantiQ modular PM. And we deployed this electric van in the month of February, 1 month after these fires first began, in two different ways. The first way is by conducting neighborhood measurements. We drove over 1,300 miles across the different burn zones, over different routes. We have different weather conditions, different times of day to try to analyze on a local level where PM1 and all these pollutants are coming from post-fire. Initial results show, Altadena having higher PM1, maybe because it's inland, and we're looking forward to doing positive matrix factorization and other techniques to better analyze or apportion the sources of the PM1 that we see and the other pollutants that we see. And I'm really excited to share some work that we're doing to develop a gridded inventory of fuel loading in the area, as well as the fuel factors to just kind of help see if we can kind of correlate the emissions that we saw, as well as what fuel we know to be in the burn zone. And lastly, we conducted some household measurements. There were 11 volunteer homes that we sampled in various conditions in various parts of the burn zones, and we did indoor-outdoor sampling comparisons between the two. As you can see, while the behavior of PM1 in particular on this graph may vary from home to home, there's also these interesting events that we saw. So a homeowner who turned on an HVAC for the first time saw a massive spike in PM1 and some VOCs, whereas we also saw that the usage of an air filter can also improve air quality greatly. And so, yep, I want to thank all the lab mates who are here, the collaborators that are part of the LA Fire Health Study, which is funded by the Spiegel Family Fund. And also want to thank HEI, and I'm very honored to get the Jane Warren Award. And I hope to see you all. I'll be at poster number 15, just off to the right over there. So thank you.
Next up is Chirag Manchanda, and he's going to talk about high-resolution urban emission mapping. Chirag.
Well, thank you. Afternoon, everyone. Today, I'm going to be talking about high-resolution urban emissions mapping. And in a sense, what we're trying to do here is bring together emission modeling, transport modeling, and hyperlocal measurements, and try and derive these observationally constrained emission estimates at a very fine resolution. So talking about hyperlocal observations, we know hyperlocal observations have their advantages. We get these fine scale concentration surfaces, which fundamentally improve our understanding of exposures. But one thing concentrations are not that good at doing is helping us understand what impacts whom and by how much. On the other hand, when we talk about emission inventories are inherently source resolved, but at the same time, there can be missing sources, misattributed contributions, and that all can lead to suboptimal mitigation pathways. Now, theoretically, a bridge can exist between these two worlds. And the entire idea behind Bayesian inverse modeling is to use these observations to constrain and correct these emission inventories in the first place. But again, the caveat there is that these Bayesian inverse models require very high spatiotemporal density observations in order to derive any meaningful corrections to these inventories. Now, so for the work that I'm going to present on today, our step one was to combine these different hyperlocal observation strategies using a mechanistic assimilation framework to try and derive those high spatiotemporal density observational constraints. Now, this is work that we've previously published, and actually, this is the work I presented on in HEI last year, so we're building on that. Once we subject these measurements to this assimilation, what we get out is a very high spatiotemporal density observational constraint. And to be specific, we're talking about 150 meters, about an hourly resolution black carbon concentrations in this context. So once we have those observational constraints, we put them together with an a priori estimate of emissions, feed them into an inversion framework that we created that we ended up calling infer. And what comes out is these posterior emission estimates, which are now aligned to match up well to the measured concentrations. Now, while there's a lot of nuance and complexity along with all of these things on the slide, what we really wanted to see was what truly can we infer using this infer framework. And there's quite a lot that we could do, but one thing that really caught our attention early on was that we were able to detect these neighborhood scale point sources, which were missing in the emission inventory. So when we started looking at different sectors, some of the sectors had really skewed corrections spatially. And once we isolated those high correction grid cells on a map and superimposed them on what's really happening there, we saw that all of these grid cells aligned really well with industrial and commercial facilities in the neighborhood, which were there on the ground, but were just missing in the emission inventory. And just to give you an idea of scale here, that's what 150-meter resolution looks like. So we rarely have the ability to tease apart these individual commercial facilities. And again, moving a step further, we wanted to see what the diurnal patterns look like. And what was really interesting to us was we were able to tease apart different diurnal profiles for each of these industrial facilities, which is further to emphasize that it wasn't a uniform scale up or scale down all across the entire sector, which is quite often the case in these Bayesian setups. But the high spatiotemporal density of the observational constraints allowed us to tease apart these very distinct nuanced corrections all across the board. Even those two neighboring grid cells ended up having these different diurnal profiles. Now, while all of this is in the emissions realm, we also care about concentrations. And now these corrected emissions can be subjected to, again, a forward model. And we can start talking about concentrations. And for that, we ended up zooming into the neighborhood further to a neighborhood called Hoover Foster, which was downwind of most of the major emissions in the domain. And what we tried to do was, again, trace back what's actually contributing to the exposures in that one neighborhood when we take that neighborhood as a receptor. And what you see here is all of the blue and the green pixels here sort of cumulatively account for just 7% of the pixels, but 60% of the exposures experienced in Hoover Foster. And what was really interesting to see was while most of these pixels were these proximate low emitters within the neighborhood, some distant high emitters upwind of the neighborhood, like port facilities and freeways, were equally important. So put together, these observationally constrained attribution of impacts can act as a powerful tool for very targeted interventions and mitigation strategies. Now, summing up, the key takeaways for us were that infer enabled us to have these observationally constrained hyperlocal emission inventories. where measurements are truly informing source attribution and mitigation impact assessment. And at the end, infer was scalable and robust to these observational and inventory errors. I haven't expounded much on the last point, and for that, I invite you to check out our poster, and thank you.
Next up is Kevin Schischlein, who's going to talk about inhaled vitamin D as a protectant against air pollution. Kevin?
Okay. Hi, everyone. My name is Kevin Schischlein. I'm from UNC. I'm going to my 4th year pretty soon. This is a bit different than a lot of the epi work being done here, but let's kind of focus more on mechanistic toxicology, looking at how inhaled vitamin D can protect against ozone exposure. So I don't need to go too much into the public health threat that air pollution poses, but a large portion of Americans are affected by air pollution at unhealthy levels, disproportionately affects people of color, and it's only expected to get worse with climate change. And so part of what I'm looking at is a novel strategy to mitigate the negative health effects of air pollution. Especially nowadays, we can't really rely on federal or government actions to decrease air pollution. So this is something that people at the personal or family level can do to protect themselves from air pollution. And so when we were first looking at strategies for this, we kind of kept on coming upon the link between vitamin D and vitamin D deficiency and lung health, where we saw all these links between pretty much any lung pathology you can think of. So air pollution was linked with lower levels of vitamin D. For respiratory infections like influenza and COVID, especially during the pandemic, there are a ton of associations between vitamin D levels and severity and occurrence of these infections, as well as a number of lung diseases were also characteristic of vitamin D deficiency. But despite this, I wasn't the first person to kind of identify this. A ton of people have tried to go into looking at vitamin D supplementation as a way to protect against air pollution, but they kept on producing negative or mixed results. And so we kind of were wondering why this supplementation strategy doesn't work when we see all these associations. And so pretty recently it was found that the inactivating enzyme of vitamin D, CYP24A1, was highly expressed in the pulmonary endothelium. So vitamin D, once in circulation, can't actually cross over into the pulmonary epithelium at relevant levels. So we wanted to find a workaround for this, which was to inhale or aerosolize vitamin D to directly treat the airway epithelium. And so I'm not going to go too much into any data, but if any of that sounds interesting, the main question I want to look at is, can inhaled vitamin D attenuate pathological responses to ozone? The spoiler is that yes, it can. And so I'll be at poster 26, so please stop by if you want something besides epi work. So thanks.
Next up is Rebecca Chagru, who's going to talk about compounding effects of wildfire-specific PM 2.5 and baseline vulnerabilities on pediatric asthma in Northern California.
All right, thank you so much. Hello, everyone. Like she said, my name is Rebecca Chagru. I'm a current postdoc in the CLEAR lab with Dr. Talker, and I'm very excited to be presenting our work on wildfire PM 2.5 and pediatric asthma associations. So I think, as no shock to anyone in the room, and for many of those who have experienced it personally, wildfire smoke events have increased, especially in the last 2 decades, almost having a stepwise increase, which has resulted in higher exacerbations of respiratory diseases. And these have been further linked to critical populations like children or those in under-resourced or underfunded communities. This has led to our work to determine the association between wildfire smoke PM 2.5 and asthma-related hospital visits. And we focused on children in Alameda and Contra Costa counties, which is located in the San Francisco Bay Area. And we used data from a local regional children's hospital located in Oakland. What we used was a distributed lag model to account for the day-to-day influences and take into account the temporal aspects of variations. And then we also added on a random effect for our census tract to include any type of community level variations that could be confounding in our model. What we found was that higher baseline risks were found in known vulnerable communities. So basically what we see on the west side of these two counties are clusters of greater risks in Richmond, West Oakland, and East Oakland, as shown on the map. And these are already designated disadvantaged communities by a tool called CalEnviroscreen, which is used by the California government. We also found in terms of temporal variations, there's both an immediate and delayed increase in the risk due to wildfire smoke, meaning that on both the day of a wildfire smoke event, there's a higher risk of asthma hospitalizations, but this also leads to higher risks on the days 3 or 4 following an event, which is critical to know, especially when we start to consider public health interventions or recommendations moving forward to reduce this type of risk. So as we continue, we're hoping to expand the geographic scope of this work, include multiple healthcare settings, and ultimately integrate this into more qualitative-based methods to improve our adaptation methods and community level response to reduce this risk. Thank you so much, and thank you to HEI.
Next up, and our last speaker is Shihao Zai, who's going to talk about sources of ozone, particulate matter, and their precursors in the El Paso area.
Thank you. All right. Hello, everyone. My name is Shihao. I'm a current second year PhD student here at UT Austin, working with Dr. Leah Hildebrand Ruiz. And today I'm talking about sources of ozone, particulate matter, and their precursors in the El Paso area. Oh, there we go. So El Paso has exceeded the national ambient air quality standard for PM 2.5. And one of the reasons why we're so interested in it, because fixed site monitoring stations in El Paso, we have seen concentrations of more than 35 micrograms per meters cubed. So therefore, understanding the composition and sources of PM 2.5 is crucial in the area. Here, I'm kind of showing several pictures. One of them is a smog event in summer 2022, where you can see the white smoke floating above the skyline of El Paso. And then also on the bottom left corner, you can see the geographic location of El Paso is kind of western Texas. If you drive from here Austin to El Paso is about an 8-hour drive, and it's also in the middle of a desert. So there's a lot of particles going on. To conduct the measurements, we deployed our electric mobile van. We fitted it with 2 mass spectrometers. One of them is called the Vocus 2R proton transfer reaction time of flight mass spectrometer. And the other one is called the high resolution time of flight aerosol mass spectrometer to measure the PM levels in the area. So going to some preliminary data, we see that here is a map of a mobile measurement that we did on January 10th of 2025. And we see that each point on this map represents a spatial point where we have data. And the color of that point actually represents the concentration of PM 2.5 or PM1, correction. So the dark blue color represents PM of less than 1 microgram per meter cubed, and the red color represents PM of more than 20 micrograms per meters cubed. And on this map, we can see that the high concentration area that we observed during this drive is actually when we're driving along the highway that borders Mexico. And if you look at the wind data from this day, the wind is actually coming from the western direction. So one of the early things that we can see from the study is that cross-border transport and wind direction could both contribute to elevated PM1s in the area. And if you look at this data a little bit closer, we can see that this is a time series of that drive conducted during the same day. And if you look at that second peak around when we drove along the highway, you see that the aerosol composition during this time, most of the aerosols are actually organic aerosols that we see that spike here up to around 16 micrograms per meters cubed. But we also see small spikes in inorganic species as well. So if you want to learn more about my work, feel free to visit me. I'm at poster 31, and thank you so much.
So please be sure to check out their posters, and Dan has a couple of more announcements before we close.